The Lagos State government is making healthcare services affordable for all its residents with the Ilera Eco Healthcare Insurance Scheme, which is designed as a universal package that can be accessible in both public and private hospitals. Take a look.
Ensuring residents get access to affordable health care is a policy the Lagos State government is determined to fully implement. A lot of expenses goes into getting quality health care, making it impossible for many to get the care they need, which is why the Lagos State health policy is being pushed through the universal health coverage to reach all residents. The universal health coverage was formally launched in December 2018. The initiative has been repackaged by Governor Babajide Sanwo-Olu's administration and renamed Ilera Eco Health Plan. Over 200 public and private hospitals are already registered under the scheme, and more are planning to join. Some residents already on the scheme share their story.
We benefit from the state government insurance scheme, and from the registration process, we did not pay anything, and during the delivery, we did not pay anything. We appreciate the state government for what they have done, and we want more benefits from them.
The Lagos State Health Insurance is very good. Thumbs up to them, because you can never compare with what you had to pay for the insurance and what you're benefiting from it. I know of a lot of persons that die from giving birth just because because of the fear of the amount you have to pay from CS. You understand? I personally benefited from it when I gave birth to my baby, I think 2 months ago, and I didn't have to fear for the fact that I had to pay a lot for the CS because of what the Lagos State had to offer me, and I am immensely grateful.
I just advise the government, Lagos State government, to improve on it, on the facilities, because we have limited medical facility we enjoy, depending on how much you pay. And apart from that, I think that they should open a means of communication with we partakers, so that we'll be able to communicate with them. For instance, I've been in a corner, tight corner, trying to reach them. I want to renew this exercise, but I've not been able to.
Since we started this health scheme, we have been enjoying it as a teacher in Lagos State. It's only those that did not fill the form, but those of us that fill the form, we are enjoying it, because during around December to January, I was admitted here for 2 weeks. So they did a good service to me. That's all I know about this Lagos State, and our governor too is trying for the civil servants in Lagos State.
The healthcare here at least has been encouraging. They put on a very good avenue for those that are not really financially okay. At least they can still support, so it makes it easy that you can access the hospital anytime you want, not that until you have big money or things. And the hospital have been trying, they've been giving us the necessary drugs to support us, and ever since I've been using it, I've been grateful to our governor.
According to the medical director of County Hospital, over 6,000 residents are registered under the Ilera Eco Health Scheme at the facility and are given all necessary services.
A lot of persons have been benefiting from it. Since the program started, we've had in County Hospital, for instance, we would have done nothing less than 20 cesarean sessions. I mean, talking from say, maybe in the last 8 months, yeah? About 20 cesarean sections. We would have had many hernia operations. We've had breast lump removed, all under the scheme, you know. And the good thing is that these persons just come in, they do the surgeries, and they go home happily. 6,000 to 7,000 enrollees, we have them on our list already. We don't have a select date for anybody. we're a 24 hours hospital, and anybody walks in, the treatment is same. Our care for everybody is same, whether you are from the private health insurance, the state health insurance, or the federal health insurance, or even a walking patient, private patient. We care for everybody same way. It's a portal system. Once you check the platform through their portal, I will find your name there. That's all. I even have a patient who is currently attending antenatal. The wife had done CS. They've done 2 cesarean sections in the past as a private patient. Somehow they saw a patient who was just discharged, and they got wind of the stuff that if they can. I said yes, and immediately the man bought the insurance from us here. He registered through us and paid into government account, and he's enjoying it now. We are preparing him for anytime soon for his operation too. Their capitation is 360 naira, right? Yes, that will only favor hospitals that have large volume of enrollees. But those that have a small volume of enrollees, it will not be good business for them. If they can increase the capitation, right? Yes, we heard that more patients will come in through the residents of Lagos, but then we still ask for a higher capitation, at least something above what it is now, will make more sense.
The State Health Management Agency is reaching out to more residents, asking them to tap into the health insurance scheme and get affordable health care.
The Lagos State Health Scheme is a program for the masses. It is a scheme that has been conceptualized to be able to make health accessible, affordable for even the common man, no matter your economic or socioeconomic status in Lagos. Current benefit package now consists of things like childhood illnesses, febrile illnesses. Your wife is pregnant, you can have antenatal care. She can even have cesarean section if it's necessary. We also treat chronic ailments like hypertension, diabetes, asthma. Those are things that are taken care of under the scheme. We have facility for people to get admitted. Blood transfusion is also available. Emergency care is also under the scheme. You can also have access to radiological services as well as laboratory services as the need arises. We also have surgeries that you can benefit under the scheme, such as appendectomy, herniorrhaphy, and so on and so forth. We've actually done a lot of due diligence, and we feel that this benefit package is able to provide about 80 to 85% of what a normal visit to a facility would require. We have the registering online because we are not excluding the middle class or those amongst us that are literate, and it's something that provides ease of registration. However, we know that the larger majority are people that will need some level of assistance, and we have tried to expand our presence within the grassroots. So within the local governments, we do have desk officers that you can visit. We have a relationship with First Bank. They are First Money agents that are across all the grassroots. Ilera Eco in itself, the name is to make the rural areas and people of the lower class feel that this thing is for them, and they can, it's not something that is unattainable to them. So currently now we have about 220 facilities that are registered under the scheme. We have some that are public and some that are private. Whether it's a primary healthcare facility or a secondary healthcare facility in the public space, they are also under the scheme. We have private facilities spread across all the local governments also under the scheme. Once you've registered, your policy is for 1 year. So we expect that towards the end of the year, you will now you will renew your policy so that it is active for the following year. 8,500 for an individual for a year, and 40,000 for a family of 6 also for a year. So that's husband, wife, and 4 children. If you have an extra child, you have more than 4 children, and the child is under 18, you pay an additional 6,000 in addition to that 40,000. So that's what the costing for the scheme is.
So far, more than 300,000 residents are registered under the Lagos State Health Insurance Scheme, and the state government is asking interested persons to visit their preferred hospitals and get on board.
Dear Lagosians, the second wave of the deadly coronavirus pandemic is here. Its new strain is easily transmitted and deadlier. Coronavirus symptoms are fever, dry cough, tiredness, difficulty in breathing. We can all prevent the spread of this virus through appropriate and regular use of face masks, avoiding close contact with people who are at high risk, Washing our hands regularly with soap and running water, especially after visiting the toilet, before eating and after coughing or sneezing. Using alcohol-based hand sanitizer. Maintaining at least 1.5 meters or 5 feet distance from anyone coughing or sneezing. Covering our mouths with tissue while coughing or sneezing and brushing the tissue. If you feel unwell and show symptoms of coronavirus or you notice anyone who does, please call the Lagos State Emergency Hotlines 08000 ECOMED or 0803 33 56 5529. Many are dead. Don't fall victim or die in ignorance. Report now. Together, we will overcome this challenge. Igbega Ipinle Eko, Ajumoshini, Lagos State Government. Announcer.
And this is where we call it today on this week's edition of the program Dateline Lagos. As always, thank you so much for watching. I'm Ayotunde Balogun. Till next time, stay safe.